Distinguished guests, ladies and gentlemen, online viewers from around the world, welcome to join us at the webinar of Taiwan and Malaysia. Join hands in bringing greater health to life. My name is Angela Liu, your MC for today's event. The COVID-19 pandemic has highlighted the importance of international medical exchange. And with that, Taiwan's Ministry of Health and Welfare and Taiwan's External Trade Development Council, TAITRA, has organized today's online event to discuss the cooperation opportunities between Taiwan and Malaysia. In today's program, we will be focusing on two main themes: medical service and smart medical. 6 hospitals and 3 healthcare companies will be presenting to share with us their latest disease treatment technology and also smart medical innovation. Today, we're very happy to have international buyers and friends joining us online. A very warm welcome to those of you watching from Malaysia and all parts of the world. To begin with, we would like to invite Deputy Executive Director of TAITRA, Ms. Babs Cheng, to give us the opening remarks. Let's now welcome Ms. Cheng.
Good afternoon, ladies and gentlemen from Malaysia and all over the world. First of all, I would like to welcome our honorable guest from Malaysia, Mr. Gung, President of Malaysia Medical Device Association. As we speak, the ongoing situation of the coronavirus pandemic remains severe. As of this morning, the total number of confirmed global cases is more than 55 million, with more than 1.3 million deaths. I sincerely hope that all of you are safe and well as we fight this global COVID-19 crisis together. Many countries are exploring ways to counter the threat of COVID-19. Taiwan has extensive knowledge of public health, as well as medical service resources, and has accumulated rich experience in epidemic prevention stemming from the SARS outbreak in year 2003. Therefore, while facing the threat of COVID-19, Taiwan has utilized an advanced deployment of these government resources by immediately initiating border controls, putting together a national face mask production line team, and implementing technology-based epidemic prevention methods. Furthermore, this June, TAITRA launched an online Taiwan anti-COVID-19 pavilion, which shares Taiwan's experiences and matches supply and demand needs. For medical technology and medical devices, the pavilion also enables international visitors to seek the best solution for themselves. COVID-19 may restrain our physical interaction, but it does not restrain our innovation and thought. The worldwide healthcare market is estimated to exceed $1 trillion by year 2023. In order to meet the broad range of needs, healthcare facilities and providers in Taiwan are ready to offer the valuable services and quality instruments for global market. 9 high-quality healthcare institutions and companies gather here today to present the characteristics and strengths of Taiwan's healthcare industry in medical services and smart healthcare. I do hope during their briefing, entrepreneurs from both Taiwan and Malaysia can cooperate with each other and benefit more patients who are really in need around the world. TAITRA has established for more than 50 years and has 63 overseas offices around the world. We are committed to actively meeting the demands of international visitors and dealing with the challenges of this pandemic together with the world. Before I finish, I would like to thank you all for your participation today. I sincerely hope this event will be of benefit to anyone. Thank you.
Thank you very much to Ms. Cheng. Next, we would like to invite President of Malaysia Medical Device Association, Mr. Yong Tuan Hen, to share a few words with us from Malaysia. Let's now welcome Mr. Yong.
Thank you very much for inviting me and with the honor of giving you the opening address for this forum we organized by TaiHao. The pandemic of COVID-19 is affecting everyone globally. The government around the world are attempting very hard to strike a balance of providing support to the lives and livelihood today. And they are finding ways and means in investing into growth as well as an economic recovery for tomorrow. This is a very big task. Likewise, in Malaysia, it's trying very hard to strike a balance between sustaining and containing the spread of COVID-19, as well as supporting and sustaining the economic situation of the country. There are many unemployment now. All these efforts have resulted in financial constraints from all sectors, many business closing down, complying to the SOPs and business regulations, movement restriction from the authorities, downfall of business volumes for export and domestic, essential, non-essential products and luxury items. Unemployment rates are expected to escalate here, and this has resulted in other populations seeking healthcare from public hospitals than private hospitals where they could afford before. In my opinion, the progress and opportunity of the vaccine is still unclear, and the time and ability is still uncertain. Even with all these negative factors, I applaud TaiHao and the Taiwanese government for their dedication in organizing such forums with the leading hospitals in Taiwan, sharing their views and experiences towards a better healthcare and lifestyle. The e-healthcare may complement to assist examples in overcoming our traveling restrictions, the congestion, social distancing issue, cross-infection exposures, and private presence, as well as to get medical care off-site. And I think smart medical solutions are needed today because we are not just thinking of the general public, but we are thinking of the frontliners. I would like to encourage as many of my Malaysian friends who are now online to get involved in providing and participating in this webinar, and as well as to try to gain more knowledge and information from the frontliners in Taiwan. I think they are a leader in controlling the COVID-19. So with that, I'd like to wish you a nice session and take care and stay safe. Thank you.
Thank you very much to Mr. Yong. Moving on to the first panel discussion, Leading the Way to Better Healthcare. Please join me to welcome the host and panelists of this session. First of all, we have Dr. Jacob Fong from Chang'an Memorial Hospital, Linkou. Dr. Fong will also be the host of this panel discussion. Next, we have Dr. Jen Wei, Superintendent of Zhenxing General Hospital. Dr. Wei will be making his presentation online directly. And next, we have Dr. Harriet Hsin, Director of International Medical Center from Dalin Hospital. Next, we have Ms. Eva Chen, Secretary of International Medical Center from National Cheng University Hospital. And last but not least, we have Dr. Yijing Cheng, Director of Aesthetic Medical Center from Taipei Medical University Hospital. Let's now hand the floor to our host, Dr. Fong.
Good afternoon, our dear friends in Malaysia and Taiwan, and also the attendants from all over the world. It's my honor to host these sections, and I'm happy to have a few colleagues from Taiwan's hospital to join with me. First of all, I'd like to introduce my hospital. I'm from Chang'an Memorial Hospital in Taiwan. And we are biggest private hospital in Taiwan. In the whole country, whole island, we have more than 7 branches of hospital, and we compose of 3,654 bed in Linkou Medical Center only, and the whole system we have 10,000 beds, and we are a private hospital that began in the year of 1974. Is our founder, one of the most important and most successful entrepreneur in Taiwan, Mr. Yong Ching Huang. He donated a big sum of money and to make us become a non-profit organization. It's a non-profit hospital. And Chang'un is a memorial of his father's, under his father's name. So now you can see we have 8 acute care hospital all over Taiwan. And we also have nursing home. And also we have this healthcare culture village. We can have retirement people to stay inside this culture village. And in fact, our hospital in the past, we acute hospital, we service many Taiwanese patients. And in the past 10 years, we have also moved into the medical tourism, and we also serve many international patients. And you can see we are taking care of acute, chronic, and long-term care patients. And comparison with the world hospital system, I think we are the biggest, the largest medical system so far in the world. And we can see more than 8 million visitors per year as outpatients. And not only medical service, we think that in order to have a substantial development in the medical service, we also have medical education system. We have this Chang'un University, and also we have this nursing school. And this the main power resource that we can recruit from this medical system and medical school. And not only that, I think Chang'un is famous in the world now because we have many visiting scholar, international fellow who come to our hospital to learn from us. So as you can see here, we have many doctors, even from so-called the Western country like UK, Singapore, and USA. So I think we are well known, especially in the plastic surgery area, and we have many visitors. And as this is a opportunity to communicate with the world, and especially in the Malaysians, we can. This is something that we can think of in the future. We can collaborate. We can have this patient referral and doctor training as an input of medical, and as an output, we can go have a telemedicines, and we can give this kind of education and providing our experience in hospital management, eHealth, and also supplying this medical material to the need of the, people in the other world. And also, we want to bond with each other with the connection with the world health organization or health worker, and we can work together and to provide the best service for our patient. So with that, I think our founder motto of having this Chang'un established is to promote population health through medical service and benefit mankind with sincerity and diligence, and to be a premier healthcare organization. Thank you for your attention. I think my presentation will be here, and I'll pass my PowerPoint to the next speaker, Ms. Lim.
Good afternoon, ladies and gentlemen. On behalf of Cheng General Hospital, it's my great pleasure to introduce our medical teams to all of you. I will start from introduction to Cheng General Hospital, then our expertise. Cheng General Hospital is located in Taipei, Tianmu area. We are a general hospital, and I believe you have all the specialties you need. Cardiology is definitely our expertise. We have made many world records. I'm proud to say that we offer the best care for patients with cardiovascular diseases. Next, I will talk about our heart center. Our heart center consists of 4 divisions: cardiovascular surgery, cardiology, pediatric cardiology, and cardiac nursing, as well as 2 units of cardiac intensive care and cardiac rehabilitation. We have made lots of world records, such as in 1988, we had done our first successful heart transplantation in Taiwan, and in 1996, we did the first heart kidney transplantation in Taiwan. And in 2001, we did the first heart transplantation for a very small baby without blood transfusion. And in 2004, we had successfully done the patient of heart transplantation using a very long ischemic time, which is 13 hours. That's the world record. In 2006, we designed a vascular ring connector, which is used for the surgery of aortic dissection, and it has been approved by FDA. It will greatly increase the survival rate of the surgery for this kind of patients. In 2009, we hold the first Cheng Live to demonstrate the heart operation to all over the world. And we held this activity every year. And in 2010, we helped Vietnam for the first heart transplantation, which is the first case in Vietnam and a very successful one, and it's the Vietnam's record. And we have also done a lot of TAVI cases for the critical aortic stenosis in the aged people. And the oldest one we had done is the 100 years of age. And now the patient is already 107 years of age, and that lady was still very well. Well, I would say that our heart transplant case is the top in Taiwan, and more than 50 cases had already been survived for more than 20 years. And the survival rate of our TAVI surgery is also the highest in Taiwan, which is 98%. Next, I will talk about our Health Management Center. Our Health Management Center is the integrated service center for preventive medicine. It offers comprehensive medical care by a team of expert physicians specialized across multiple fields. This year, we had just purchased the latest 3T MRI, which is the world's finest 3T system that will offer the very rapid imaging, zero radiation, and very high resolution. Since 2006, we started our telemedicine for the patient cardiac diseases, which is the first center set up for this kind of purpose. And we believe that this kind of service will be the future trend. Well, if you are interested in our services, please contact us with the email or telephone. If you are coming to Taiwan, we will arrange visa application, your accommodation, or even airport pickup, and your travel plan. If you're not coming to Taiwan, you can also to contact us with telehealth consultation. We can give you very good advices. Okay, thank you again for your attention. Bye-bye.
Thank you very much to Dr. Wei. Next, we would like to invite Dr. Harriet Hsin from Dalin Hospital to share her presentation.
Your Excellency, distinguished guests, ladies and gentlemen, good afternoon. And to our Malaysian friend, Salaman Tengah Hari. Thank you for taking the time to join us in this webinar sponsored by TaiTra. Today it's my honor to introduce you to humanity care through advanced medical technology at Dalin Hospital. I will brief touch upon our hospital history, mission, and work, and then I will show you our medical specialties. But first, let me show you a video of day in the life at Dalin Hospital.
固定我看一下哦，真的都上面都变形了，以后就近端关节会慢慢变，大家都要全力来对抗这个疫情。
Cheng, founded by Master Cheng in 1966, is built on the value of charity, medical care, education, and humanity. In 1972, Cheng set up a free clinic in Hualien to provide medical service to the poor twice a week. The free clinic remained in service until the first Cheng Hospital opened in 1986. Cheng has 7 hospitals throughout Taiwan. Dalin, which opened in the year 2000, is the first Cheng hospital in Western Taiwan. Dalin Cheng Hospital itself is made up over 2,000 staff, managing 36 department centers and 40 subspecialties. We handle over 800,000 OPD visits and 200 IPD days and more than 900 beds annually. On top of our local patients, we also cater to hundreds of international patients from 16 different countries all over the world and growing. Here are our highlights specialties at Dalin Cheng Hospital. Let me expound on a few in particular. First off, dyschromia, also known as vitiligo, is a disease that causes progressive loss of the melanin in the skin. At Dalin Cheng Hospital, we use combination immunomodulation therapy to control the progression of the dyschromia in 98% of our patients. Moreover, 35% of patients showed a pigment regeneration within 6 months. We are also proud to share that patient satisfaction from our dyschromia treatment is 90% and 97% after 1 year and 6 years, respectively. Next, we also specialize in minimum invasive spinal surgery. Compared to traditional spinal surgery, this results in less harm to nearby tissues, less pain, and faster recovery. Using the latest in medical technology, our team is able to recommend the best treatment options for each specific condition. Now, let me share with you a case last year of a Malaysian patient who was afflicted with the meningioma, a condition with a traditionally low surgical success rate, and who was told that he would only have 2 years left to live. With no options available to him at that time, Cheng volunteers in Malaysia suggest that the patient come to Dalin for treatment. Despite various difficulties, he managed to make it for the 12-hour surgery, and today, not only is he alive and well, and he can work stably by himself. Last but not least, Dalin Tzu Hospital is well known for its knee health promotion option or KHPO, a comprehensive treatment plan for knee osteoarthritis headed by Dr. Lu. KHPO has been included in several English and Chinese science publications and have been selected by the Taiwan Joint Commission as one of several medical specialties for international promotion. KHPO treatment ranges from conservative non-surgical procedures to several surgical procedures depending on the patient's condition, with evidentially supported coming from 12 scientific papers. We also want to share that we perform also scopic cartilage regeneration facilitation procedure, or ACRFP, one of the effective treatment options for knee osteoarthritis. The efficacy of our KHPO program is such that satisfaction rate for ACRFP is at 92%, while knee replacement procedure has a satisfaction of rating of 100%. With this, we invite you all to be part of our growing list of international patients who come to Dalin Tzu Hospital and discover our humanity care through advanced medical technology. Thank you, and terima kasih.
Thank you very much to Dr. Shen for your presentation. Next, we would like to invite Ms. Eva Chen from National Cheng University Hospital to share her presentation.
Good afternoon, everybody. Sorry, I need to apologize first since I'm wearing a face mask because I have a sick. So the face mask is to protect everybody here. It's my honor to be here during this event, and now I'm going to give a brief on my hospital. My hospital that is situated in Tainan City, and we also have a branch hospital in central Taiwan, which is around 100 kilometers away. And since we are a university hospital, the history of our hospital can trace back to 1931, when the school was first established as a engineering college, and the school system has transformed into a university in 1956 and has named Cheng. Our hospital was officially opened to the public in 1988. After 5 years, we had our College of Medicine. In our hospital, we have more than 5,000 staffs, and over 60% they are doctors and nurses. And we have 1,354 beds, and more than 70% are acute beds. Here below, you can see the map of the Cheng University Medical Center map. We have two main buildings, the outpatient building and the inpatient building, which is connected by a sky bridge. And one next to the inpatient building is our College of Medicine. Since with the core value of life, love, excellence, and creativity, we not only provide educational and research services to the medical personnel, we also provide comprehensive and heartwarming medical services to the public. Okay, and now to the public. Okay. And now I'm going to talk about the highlights of our hospital. And besides having the age-cutting medical devices such as the Da-Vinci surgical system, the hybrid OR, PET-CT, MRI, we also have the multidisciplinary teams to provide comprehensive treatment care to the public, such as the transplantation team, cancer center, ART, stroke center, Alzheimer's disease prevention center, diabetes prevention center, such like this. And also, we also devoted ourselves into the trend fields, such like AI, nanomedicine, precision medicine, maternal fetal medicine. And what I want to talk about is about our transplantation team. In our hospital, we have our own organ bank, and so we can do the ABO incompatible transplantation and split liver transplantation. On percutaneous intervention, we made a world record on extremely low birth weight babies, which is only 478 grams, and in 2017, and without any brain insults. And as we all know that Taiwan has officially been an aged society in 2018, but early in 1999, we already have the first elderly friendly ward in Taiwan. And now we are building also the first geriatric hospital in Taiwan, and it will be done in 2022. As a medical center, our hospital also upholds social responsibilities. We conducted international collaboration programs early from 2008. Now we have the link with Kenya, India, Vietnam, Indonesia, and some other SEA nations by co-hosting international conference, joint research, and a medical personnel exchange. Moreover, our university has 3 overseas research centers in Thailand, Malaysia, and Vietnam. The one that set in Malaysia is in University of Malaya in 2017. The Overseas Research Center is responsible for the industry-academia collaborations, and we believe that the link is helpful in strengthening the partnership and will benefit 2 sides. Thank you.
Thank you very much to Ms. Chen. And next, we would like to welcome Dr. Yijing Cheng from Taipei Medical University Hospital to share her presentation.
Hello, friends in Malaysia. Thank you for joining us in this webinar. Located in Taipei's prestigious International Hsin District, Taipei Medical University Hospital has achieved JCI accreditation for the 4th time last year. We have over 30 centers and 46 specialty departments offering specified and comprehensive advanced treatments to different fields of medical needs. We provide friendly environment for international patients. Our coordinators will help patients go through every process in the hospital. Among the centers of excellence, now let me introduce the Aesthetic Medical Center of TMUH, where science and art meet. TMUH Aesthetic Medical Center is aimed at providing patients healthy and natural beauty. We are proud to assist people from all around the world regaining their healthy, glowy skin. Our center is comprised of board-certified dermatologists and plastic surgeons with their international experiences in teaching and in training in the cosmetic realm. We have state-of-the-art devices and techniques in lasers, Botox fillers, and non-invasive lifting and body sculpturing. For example, our therapy is a US FDA-approved non-invasive skin tightening and lifting treatment. It reverses skin aging by delivering energy with micro-focused ultrasound into the deep layer of mass layer underneath the skin and stimulate collagen elastin neogenesis. We also provide high-quality US FDA-approved cosmetic injectables imported from Europe and the USA. For example, Botox, Restylane, Juvederm, and Sculptura and Radius. We're going to have Belkyra soon, which is an injectable that could destroy the fat cell in the area under the chin, commonly described as the double chin problem. With hyaluronic acid fillers, we can achieve natural facial contouring results without surgery. You can hardly tell which side of the before-after photo is a result of cosmetic procedure. providing some volume to our face appropriately, you may look many years younger without surgery. Here's another example of global facial rejuvenation with cosmetic injectable. For brown spots, acne scars, wrinkles, hair removal, tattoo removal, and facial vessels and redness, and non-invasive body sculpturing, we also provide widely recognized good results. All our lasers and devices are from USA and Europe, both Taiwan and US FDA approved. We have the latest picosecond laser treating the most common problem of cosmetic in Asians in skin pigmentation and brown spots. We also have non-invasive body sculpturing, meaning that you don't have to go through surgery, but we can reduce the fat in local area to achieve body sculpturing. Let's take a look at an example of the results of Fraxel laser in removing acne scars. Nordly's IPL, removing brown spots without leaving any wounds afterwards, meaning that you can wash your face beginning the first day after treatment. Besides non-invasive treatments, our plastic surgeon team also provide great attention to liposuction with Vaser technology, facial plastic surgeries, fat transfer, and breast reconstruction. Feel free to express your needs to our experts. They will always assess your skin first, discuss with you about your treatment plans before every procedure. Our caring aesthetic nurses will also work closely with our physicians, guide you through the entire process, and provide the last touch of our gentle care before you go. Taipei Medical University Hospital Aesthetic Medical Center strives to provide our patients an elegant and comfortable environment so you can relax and feel just like home. For more information, please visit our website and my blog. Thank you for your listening.
Thank you very much to Dr. Cheng for your presentation. Moving on to the Q&A session, we have received 2 questions from Malaysia, and now we will connect with our partner in Malaysia. Hello, Tanya. You may now proceed with the questions from Malaysia.
Hi, good afternoon, everyone. My name is Tanya. I'm glad to attend today's webinar. It's very informative. I'd like to raise 2 questions here. My first question is to Chang Memorial Hospital. What kinds of cancers and patients are suitable for proton therapy? And my second question is to Taipei Medical University Hospital. How can we start to get healthy and natural beauty? And what kinds of treatment would you suggest? That's all. Thank you.
Okay, I would like to answer first. Thank you for your question. As I remember in my presentation, I haven't mentioned our hospital, Proton Center, as the first center in Taiwan, and also one of the kind of center in Asia. So for proton therapy, I think basically this is a high advanced radiation therapy facility. So basically, it can be used for all kind of cancer, especially cancer in the deep organ, deep inside our body, such as tumor in brain. Especially, it is really good for brain tumor, in the eyes tumor, and also now we have great experience in the liver tumor as well. And in fact, the principle of this proton therapy is that it can target the lesion without damage the surrounding tissue. So whenever you think of a tumor in a very important or very critical area, and you don't want to injure the normal tissue, you probably can think of using proton therapy. So basically, what I want to say is that if you have this problem, or if a patient needs such a treatment, you can contact us, and then we can give you a good evaluations before we will suggest you what is the best treatment for this patient. I hope my answer is short, but I hope you can get some point of the principle of this proton therapy. Thank you.
Thank you.
Thank you for your question. About the question to how to achieve natural and healthy skin, natural beauty. First of all, in order to be pretty, to be beautiful, you have to be healthy in the beginning. So if you go to our aesthetics medical center, first our dermatologist will look at your skin. If there is any health problem in the skin, or even health problems relating to the internal organs, we may be able to have you transfer to other departments or treat at the dermatology department first. And if there is no health issues on the skin, then we want to focus on the issues that our patients are looking for. I think most of the Asians are very concerned about their skin color being uneven, which means they want some skin toning and removing some brown spots on their face. And that we would usually use most of our lasers in combination. Our doctors have extended experiences not only in treating the Asian skin, but also skin of different colors from international patients. We actually have many international patients with different skin colors already. And secondly, many of our mostly women, they are looking for non-invasive treatments to look younger. They don't want to go through invasive plastic surgeons with general anesthesia. They want to do less invasive treatments with good results, but very minimal downtime. But they're also worried about unnatural results, especially for with fillers and Botox. And that is something we are very specialized in. For example, as for me, I was trained in cosmetic medicine in MGH laser and medical centers in New York. We have also other doctors who have been having international training experiences. And we have many experiences over the years with our Asian women and men. So we are very popular that in the first place, we would suggest all therapy to achieve some skin tightening. And then we will see if we have to arrange some appropriate volumes to support, for example, the cheekbones or to fill out some of our wrinkles and folds. So the most important is natural. Natural means you have to preserve the elegancy that you have inside you, the spirits that inside you. So that's why in the beginning of the presentation, I say my department is where the science and art meet. Thank you.
Thank you very much to Dr. Cheng and also Dr. Fong for answering the questions for us. And thank you once again to all our speakers for sharing your presentation today. Thank you very much. Please return to your seats. Thank you once again. And to our audience, if you have more questions, please leave your message. Our speakers will contact you after the event. And now moving on to the second session today, Advancing the Boundaries of eHealth. And now please allow me to introduce the host and panelists of this session. For our host, we have Dr. Nina Gao, CEO of Overseas Medical Mission Center from Changhua Christian Hospital. And next is our three panelists. We have, first of all, Professor Xu Weifang, founder of Biotegy Corporation Ltd. Ms. Julia Cheng, sales manager of TaiHao Medical Inc. And Mr. Baron Xie, business development manager of iMedTech Co. Ltd. Let's now hand the floor to our host, Dr. Gao.
Thank you. Good afternoon, ladies and gentlemen. This is my great honor to have the opportunity to introduce Changhua Christian Hospital, Smart Healthcare, and International Medical Service. I'm Nina. I'm the CEO of Overseas Medical Mission Center. This is the hospital. We are founded in 1986. So now it becomes the biggest healthcare system in central Taiwan with 9 branches and over 4,000 beds. We also built the first green and smart hospital in Taiwan, the name called Yuanling Christian Hospital. So we have professional knowledge and technology in smart hospital and smart healthcare design, construction, and management as well. And we are very happy to share this model to our friends in Malaysia health providers. As I know, the Malaysia Industry 4.0 is your national plan in the future of 10 years. And also the IoT and smart healthcare is also one of very important your policy in your countries. So we are willing and happy to share this model with all our friends from Malaysia. So this is the Yuanling Christian Hospital. So from the map of Taiwan, you will see we are now in north. We are in the central part. So the 2 pictures is the hospital's appearance. One is in daytime and the other one is in nighttime. And I'm going to share one video of the hospital. So from the video, we'll see how the hospital integrate all of the IoT system into the hospital management and the medical service.
In the future, Yuanling Christian Hospital is looking towards Asia to become a model of smart hospital in Asian regions to provide the best medical services across the region. Welcome to Yuanling Christian Hospital.
Okay, this is Yuanling Christian Hospital's briefing. So what we can work together, as I mentioned, because the hospital from design to construction and the operation almost by our team, and also working with some of very outstanding of companies that's in Taiwan. So we have that professional knowledge and technology in smart healthcare design, construction, and management consultation. We also have the 1-week study tour for the hospitals and director and manager. And we also have 1 month to 6 months, even over 6 months on advanced professional training for medical staff. And for the international patient, we also welcome the Malaysia patient if you seek on some of specific disease, the treatment. So you can see even that in the pandemic era, even in the pandemic period, that we also integrate many of the IoT or smart technology into the COVID-19 prevention. So this is my presentation. So I'm looking forward to working together. So this is my presentation. And in today's session, we still have three other of outstanding companies in Taiwan, and their products also relate to the smart healthcare. So I'm going to introduce them to introduce their product. The first speaker is biotech company. The speaker is Professor Fang, and he's also the company's founder. And his topic, we will be going to share the design and development of invasive, maybe invasive surgical biomaterials. So Professor Fang, please.
Thank you, Nina. Good afternoon, my friends in Taiwan and Malaysia. Okay, we're waiting for our slides. Okay, so I'm Professor Sui Fang, and today I'd like to introduce our company and our services. We are doing the design and the development for minimally invasive surgery biomaterials. Maybe I will introduce a little bit about myself. I'm a professor at the Chemical Engineering and Biotechnology at the Taipei Tech University, right, which is a very old history university, focusing on the application development and the applied research. Okay, and I've been working as a director of incubation centers, and my expertise is biomaterials, medical devices, and tissue engineering. So 5 years ago, I got this idea. We found a lot of professors has good technology, and we do have a lot of small and medium enterprises who are interested in developing more products. But there exists some gap between the academics and the industry. So I'm trying to build up a new business model to accelerate the novel medical device development. Right. So that's a pain point, and that's the problem Biotegy want to solve. Okay. We do know in Taiwan, we do have a lot of good technologies in terms of materials, in terms of chemicals, in terms of electronics. But for developing medical devices, there are a lot of regulatory issues you also need to take care. So we need an integrator and someone to help the whole process more smoothly, right? So that's a job of Biotegy. So I just summarized a little bit about some achievement we have made in these years. So we are focusing on some innovative biomaterials, and especially for the minimal invasive surgery biomaterials. And one very special example is our Bob sutures. Okay, we got this idea from our market channel friends. Okay, they want to develop these devices because at that time there are no licenses products in Taiwan. So we got this job. We connect the efforts from the university and also from the GMP factory, and then within 2 years, we achieved the research development and also the mass production, and we get the medical license in Taiwan. And we are also now apply the US FDA and the Europe approval. So that kind of rapid development is the core ability we can provide. Okay, and here you can see we also have several technology in our portfolio, including the ultrasound therapeutic devices and the breast implant injector and so on. Okay, so here are some licensed products we have. The first one in the left hand is the Bob sutures, which we got the first license in Taiwan. And we are going to develop the second generation of our products. And we hope to get one license each year for the next generations of Bob sutures, which can be used for the minimal invasive surgery and also for the cosmetic medicine for facelifting and other applications. And we also have this novel SurgeJet bone grafts. And then we, not only the medical device, we also have some cell therapy strategies for cartilage repair, as you can see in the right side. And also, as I mentioned, breast implant injector, we got a license. And we also work with Dr. Berman in Beverly Hills in the United States to do the commercialization process for a very novel pocket protector to deal with the capsular contracture for breast implant. Right? And we did a lot of technology commercialization for B2B, okay? And from 2020, we also try to do some good products to our customers, all right? The first one is our skincare products. We have this new brand name, Puriposh, and we applied all native local plants in Taiwan and hope to provide more people to enjoy the outcomes of our research. So we are willing to collaborate with doctors, collaborate with market channels for good product development. And then we like to share the profits, and we also share the risk. Okay, I think based on our help, we can develop more innovative products soon and better. Thank you very much. We are Biotegy.
Thank you very much for Professor Fong. They are very innovative product. So our next speaker is Julia Chang. She is the sales manager of TaiHao Medical Companies. She's going to share on how use the IoT system, the software integrate into the to implement the imagination, particularly in the breast cancer. Julia, please.
Thanks, Nina. Ladies and gentlemen, good afternoon. I am honored to have this opportunity to introduce TaiHao Medical Inc. to Malaysia. I am Julia Chang. I am working in sales division of TaiHao. TaiHao Medical is an artificial intelligence company designing and developing medical software. Currently, we provide a solution for both handheld and automatic breast ultrasound. Why go from TaiHao? To empower physicians with the best possible solution, to improve diagnosis accuracies, to provide health care at a lower cost, and to enable physicians and the patient to achieve a better outcome. But why we choose the breast? Because the breast cancer is the most common cancer among women around the world. Every 15 seconds, a woman in the world is diagnosed with breast cancer. In Taiwan, 7 women die of breast cancer. And why we choose the ultrasound? Because the most cancer detection, such as the mammograph, ultrasound, and the MRI, can be do it. Because we know very well the Asian women have dense glandular breast tissue, which lower the sensitivity of the mammograph for cancer detection. That's why we choose the ultrasound. Now let me show you what solution we have. BRFHUS Smart System is compatible with existing handheld ultrasound. The main function have rectal whole scanning procedure, real-time for suspicion area finding, scanning quality assurance, review the scanning process, diagnosis assistance system, BIRACE lexicon, and the rapid reporting system. BR Fuel, it also can support the automatic breast ultrasound like GE and Siemens. The main function have ABAS image viewer, computer-aided detection, 3D manipulation, marker annotation, electronic diagnosis reporting, by-race lexicon, and plug-in fuel into the workstation 1. All of our solutions have the FDA and the TFDA approved. Let me show you how it works. Our system can show in the breast size first. When the sonograph to make the scanning, our system will show in the suspicion area and indicate the clock and the distance from nipple. Also, our system can show in the scanning coverage. This is very important for sonograph. Because sonograph make the scanning, they must be focused the screen and the probe at the same time. So our system will let them know this scanning is completed or not completed. Next slide, ABAS. We download the ABAS image into our CAD server to make the detection and the diagnosis, then to get the result upload to PAS or his system in hospital for doctor reference. We also invite 8 doctors to check our system. They have a different experience from 8 doctors. Baselines before they don't use. After using, the performance be improved 5% sensitivity and 6% specificity. Reading time saving 25 to 30%. For your reference, one doctor need 20 minutes for one case reading, but the AI solution only need the 20 minutes. So it's very important for doctor and the hospital. This is a brief introduction from us. If you have any question or want to get more information, please contact with us. Thanks for your time and the lesson. Thank you.
Thank you, Julia. Their product is quite benefit for the ladies and women. And our third of the speaker is from Imatech, and the company is one of our very good partner. So when the Unique Christian Hospital on construction design, so we're working very closely. And the speaker, Baron, and he is the business development manager, and he's going to share the smart hospital solution in Taiwan. Baron, please.
Thank you, Dalin. And hello, everyone. This is Baron from Imatech, and I will introduce some of our smart hospital solution we already done in Taiwan and want to share the experience to you. Since in the new normal situation right now, we want to more technology to help people to treat, to decrease the human contact between each others in the hospital area. So what is the strength of what we are doing? We combine the IoT technology and IoT experience into the medical applications. So in Taiwan, we are the system integrator. We combine a lot of hardware device, and we want to solve the question, the needs, and the pain points in the hospital. So we develop a lot of solutions in Taiwan already used and quite good, and want to explore these things to you. And our goal is to build an intelligent hospital. So we have some strategy like patient centers. Of course, all these things need to be operation very efficiency. And of course, it's still a hospital. So in the clinic, we must be very excellent. So you introduce some solution already done to improve the patient certification, reduce the workloading, of course, to optimize the workflow. So it's the scenario like what we already done you can see in this picture. In the outpatient area, we have some curing, broadcasting, even the vital self-measurement kiosk to help the people to decrease the waiting time in the hospital, since the waiting for a long time to see a doctor is I think it's the public pain point in not only Asian country, not only in Malaysia, but also in Taiwan. So we want to solve this question with this technology. And into the inpatient area, there's a nurse station. So we want to use technology to strengthen the connection between these two scenarios. So nurse in the nurse station, they have a lot of like a smart nurse station dashboard, some intelligent automatic dispensing cabinet. They can control, they can know each patient's regulation data, each patient's status. So in the world, we have a lot of devices like a terminal, display information, with like a lot of sensors to detect patient information. So there's some solution already done. You can see this is a smart counters in the registration area. So we calculate, we memorize all the log. So all the data, signage, something like that will pop out, and all the log will become a digital log. So we can trace, we can optimize the management to improve the efficiency. So there's some case already done, not only in the counter, but also off the clinic. We can use, in Taiwan, we can use our national insurance card to register very quickly. And this is a vital sign kiosk solution already done. So actually combine a lot of FDA-approved devices into one kiosk. So right now in Taiwan, or even the elderly, like over 60 years old, 80 years old, they can use this kiosk by themselves. So this kiosk will put everywhere, like into the lobby, out of the clinic. So the patient, when they are waiting to see the doctor, they can measure their vital sign by themselves, and all the data will become memorized and sent to the hospital information system. And there's some UI we already done. So actually we already output this solution into Thailand, into Vietnam. So all the UI you see right now is in English, but in their country, for example, in Thailand, of course, it is in Thai. So in Vietnam, you become Vietnamese. And we have some e-paper display solutions. That's where we're done. We have a different size from 7-inch to 42-inch. So it will become an information display into the hospital with energy saving, no backlight, and easy to deploy. So you can see this the bedside patient card. As soon every hospital you already seen is in the past, maybe they use a paper. They need to rewrite the paper manually every shift. So it's quite time consuming, and the nurse need to do it in every shift. So right now we use the e-paper or IPC to change the information from his automatically. And there's some easy layout. You can see there's some patient information show and some indicators. When we even have some text tolling buttons. So you can call the nursing code, call the IV code through this device. And in the back end, we have some management solution in the nurse station we call smart nurse station. So there's a lot of block you can see. Each block means one patient. So the nurse, if they want to get every patient's information, they just one click, and all the information will pop out. Yeah, like the other pages you see. So it's very quickly and very easy to get patient information. And of course, we have some sensors in the world. And this one is a TOF fall prevention solution features. Actually, it's not a camera. It is only an infrared sensor. So it can detect the patient status, patient shape in the world. So we'll know if the patient is lying on bed, leaving the bed, or even falling down behind the bed. And all the information was sent back to the nurse station. And it's, of course, it's fits the regulation because there's no camera allowed in Taiwan, as well as same in Malaysia. So we use this sensor to detect and to monitoring the patient status in the world. And of course, there's some back-end platform like this one. So every log, every status will become history data. So like already you can see. And if there's some warning, like people leaving the bed or falling down, there's some picture or some video record. You can recall and to see what's the data from the sensors. And we even have some automatic dispensing cabinet. This one is usually used in the operation room or in the ICU because in Taiwan we want to control the control medicine like the sleeping pill or morphine. So we want to use this technology to control all the medicine. Is restriction medicine. So there's some few steps. First one, maybe they scan their badge and then do the fast recognition. So I will know if you are rightful person to use this cabinet. Normally it's the doctor, nurse, or pharmacist. And after the identification, they can key in the prescription number or just scan the prescription and then get access to the right medicine for the right patient. And then maybe you already see this picture in Dr. Nina's presentation. Actually, we are doing a smart hospital intelligence solutions. So in this picture, we can see we're from the outpatient area into the inpatient area, even to the logistic and some robot application. That's what we've already done in Taiwan. Want to share and want to explore this to you. And we can see there's some other picture already done in Taiwan, not only in the Changhua Christian Hospital. I think most of the Taiwan medical centers or big hospital is one of our customer. And right now we even explore our solution into Thailand, Vietnam, and US. So right now, and thanks for your attention. And we're looking for some local distributor and collaborator in Malaysia. And if you're interested, please welcome to contact me. Thank you.
Thank you, Baron. And I think their products almost integrate to our hospital. So that's why I say if you have any interesting in the smart hospital, welcome to visit Yuan Christian Hospital. So this is in this session 4 of our speakers. Thank you very much for our speakers. So the discussion floor is open, and I'm welcome all the questions. So I'm also would like to hand my microphone to our MC Angela today. Thank you.
Thank you very much to Dr. Gao. And we do have some questions from Malaysia. So we're going to connect again with our partner in Malaysia. Hello, Cixi. You may proceed with the questions that you have.
Hi, this is Zian. We actually have 2 questions today. The first one is for biotech. If we would like to cooperate with you, how can we do so and what should we prepare? And the second one is for iMedTech. How can we start to develop smart healthcare business in Malaysia? Thank you.
All right. And I think in biology, we already developed some products. I think the first thing you can help is products are always looking for the local distributor, right? That's one thing to make a better products used clinically. And the other way is we are also looking for good ideas, no matter it's from medical doctors or from the market channels. And we are able to transform your idea to the product rapidly. Okay, and we also, under the development of the product, under the product development process, we are also focusing on provide a lot of scientific evidence. All right, so that's I think that's 2 aspects we want to collaborate with Malaysia sides. Thank you.
And
Dalin, your turn.
Okay, thanks for your question. So I think smart hospital is a big topic, and in different country, in different company, they have different definition. But in my personal opinion, of course, the smart hospital need to improve the efficiency of the hospital, improve the patient feeling in the hospital. So, of course, the first step might be the outpatient area application, like the curing, broadcasting, or patient vital sign collection. For example, the kiosk I just introduced. Actually, this is also the first solution we developed and we introduced to Thailand, even to Vietnam. Since of course, Thailand and Vietnam is all Asian country, but actually there's a quite different. I assume Thailand is more similar with Malaysia since you are even competitor in the international medical service in the world. So, so Italian case may be more suitable in Malaysia. So, they want to use a lot of solution to improve the patient feeling. Then they were very pleased to go into the hospital. So as soon the curing, broadcasting, and the vital sign kiosk should be the first state solution. And the second one, if you want to live into inpatient area, how to communicate and improve the care quality between patients and nurse, it should be the big issue. So I assume the smart nurse station and some e-paper display patient information on the bed is another good solution for you. So it's my personal opinion for you. Thank you.
Thank you.
Thank you very much to Mr. Xie and also Professor Feng for answering the questions for us. And thank you once again to all our panelists for sharing your presentation. Special thanks to Dr. Nina Gao for moderating the session for us. Ladies and gentlemen, this concludes today's webinar. Thank you very much for watching. We hope through today's presentations, you would have a better understanding on the latest medical innovation and healthcare solutions that we offer here in Taiwan. Please help us fill out a survey by scanning the QR code on the screen. We would like to hear your suggestions and feedback for future events. Thank you once again for watching. We wish you good health and all the best in your future endeavors. Thank you.